Different people have different issues, concerns about the anesthesia for the surgery, and we're kind of proud of the fact that we pay careful attention to all the steps, the preoperative preparation, the education, the surgery itself, the anesthesia, and the postoperative follow-up. Everything we pay, what we think is a lot of attention and care to each of these steps. And so one of the questions is, what about the anesthesia? And as we talked about, some people are nervous about the waking up business. You might have seen the movie where you wake up and you're paralyzed, and I forget who it was, is the guy who played Anakin Skywalker got his chest opened while he was asleep or something like that. So we have questions about that, and we're really proud of the fact that we've never had anybody with any awareness of the surgery. And,
well, and you have that head thing.
And so we have what we call the BIS monitor to measure the EEG, to monitor that. And plus, the other thing we point out is one of the big fears is not just that you'll have pain while you're under anesthesia, but you'll be paralyzed so you can't do anything to tell anybody that you're hurting. And so what we point out to our patients, although it's never been an issue, is you're not paralyzed with our surgery. We don't use paralytic agents. So we remind our patients that if you're having surgery with us and you're uncomfortable, just tap me on the shoulder and we'll give you some more anesthesia. That's right. Well, one of the other things that's pretty common is that when you wake up from your anesthesia, you're nauseated. And so you had 2 surgeries, you had nausea, is that right?
Oh,
4 terrible nausea. It turns out that most anesthetics in the United States and around the world today use gas. The gas anesthetics were the first anesthetics. In the first anesthetics, they used ether, and it was done in a Harvard building that's now called the Ether Dome, where they dripped liquid ether, it vaporized, and when the dentist operated on the patient, they were out because they had breathed in the anesthetic gas ether. Now we don't use
for tonsils.
Me too. That shows that you and I are not kids, because that was a while ago. That was when the Lone Ranger was on TV.
I can still taste it. Yeah.
That was when we had black and white and only 2 channels.
How did you?
And we had the rabbit ears. And Walter Cronkite talked to us in the evening. But we won't mention that. So you probably just heard about this because you're so young.
Yeah.
So gas anesthetics were the foundation of anesthesia, and they are still used today. They have 2 side effects that we talked about earlier. 1 person in 3 will wake up with severe nausea and vomiting. And you might say, oh, well, who cares, a little bit of nausea and vomiting, but it's real serious, from your toes, out type nausea and vomiting.
1 in how many?
1 in 3. So most people who've been through it say it's awful. And that comes from the gas anesthetics. It's a side effect of those drugs. The other side effect is because the drugs, the chemicals themselves are fat soluble, while you're breathing them in, they can dissolve into the fatty tissue of a heavy person and then unexpectedly come back into the bloodstream after they've woken the patient up. And they can put you back to sleep a little bit so you stop breathing. And you can have dangerous complications in a heavy person who gets some gas sneaking back into the bloodstream, decreasing their breathing, low oxygen, irregular heartbeat, and even death from the occasional unexpected gas coming back out of the fatty tissue into the blood and affecting the breathing. So one very dangerous and deadly complication of gas anesthetics, which is pretty uncommon, but the other much more common, unpleasant nausea and vomiting. So we do not use gas. Our primary anesthetic is a chemical called propofol, made infamous by another Las Vegas doctor. And he and I don't share an office anymore. No, I'm just kidding. The doctor who may be responsible for Michael Jackson's death was giving propofol to Michael Jackson when he passed away. And so we don't do our surgery in the hotel room. And we monitor things, I guess, more carefully. I guess Michael Jackson's doctor, from what I've read, was in the bathroom when all this happened or something like that. So I'm going to stay with you the whole time. But propofol is a very useful drug, but I don't think it should be given at home. And it does not cause nausea, but actually is an anti-nausea drug. So we find that most of our patients have very little nausea. And this morning you sat here with a bunch of other patients. No one that I heard brought up nausea as a post-op complication.
And that's why they tell us not to fill our prescription, because more than likely we're not going to need it, right?
Right.
If we do need it, we just call the office and they...
Well, you can, if you don't have it, you can always call the office. A lot of times just a little bit of Benadryl works. There are patients of ours who still do have nausea. If you think about it, another word that we use in our language for nausea is upset stomach. And it's hard to envision a stomach that's more upset than one that's just been crushed and stapled and sewed on. So we do sometimes see nausea, but what we would say is our incidence of nausea is much lower. We're not using the gas anesthetics, which are known to cause nausea, and we have a whole batch of other medicines that are used to prevent and treat the nausea. So we're hopeful that your experience in the past will not be repeated with our surgery.
We're going to have fun, girlfriend.
Thank you.
Yeah.